Coming up.
The difficulty with children and not having in-person visits, how it affects their social ability. How do you think that should affect public policy going forward with respect to lockdowns and school closures, et cetera?
These things. Has any consideration been given to perhaps ease the restriction for federal travel mandates for all children and youth?
Especially through the pandemic and with rising costs. I wonder, Mr. Aziz, if you could comment on how we can ensure access to nutritious choices of food.
Can I just get some clarity, because we did have some recent news in the census data that youth over-indexed for non-binary genders or for diverse genders.
Wellness Together or Pocket Well app. So I'm going in a little bit of a different direction, but it gets referenced a lot in terms of mental health.
Thank you very much, Mr. Chair. And my question is for Madame Clifford. And it's just in relation to research around, basically gender-based analysis plus in research. I wonder if Madame Cliff could share with this committee if there is a GBA plus analysis that happens on research that comes out of her departments.
This Guy's Garage. Like and subscribe.
I call this meeting to order. Welcome to meeting number 24 of the House of Commons Standing Committee on Health for a briefing from officials to begin our study on children's health.
Talked about the difficulty with children and not having in-person visits, how it affects their social ability. How do you think that should affect public policy going forward with respect to lockdowns and school closures, et cetera?
Thank you very much, Mr. Chair, for the question. The Public Health Agency of Canada ensures that we follow and adhere, and we advise Canadians to follow and adhere any of the guidelines that are being provided to all Canadians, and of course ask that and work with each province and territory to roll out and implement based on our public health guidelines.
Thank you. So I guess very quickly, we still have many restrictions and mandates on federal travel. Just to be one example that still impacts youth. I was on a plane yesterday and watched a parent struggling to get their 3-year-old to wear a mask through the plane because it was required that anyone over the age of 2 wear a mask on the plane. And it was very clear that this was a major struggle. A child under 5 has a hard time understanding some of these things. Has any consideration been given to perhaps ease the restriction for federal travel mandates for all children and youth?
I don't think we're in a position to answer that question, Honourable Member, given that's the prerogative of Transport Canada.
Perhaps the Public Health Agency of Canada could have some comments. I believe that they provide some recommendations to the Transport Canada when it comes to creating restrictions.
Thank you, Honourable Member. Yes, I would concur with Joe Voisin on that. It is, while we provide information and recommendations, at the end of the day, it was within the purview of Transport Canada to make the final decision on any changes or implementing any new guidelines on travel. Thank you.
But given the challenges, especially through the pandemic and with rising costs, I wonder, Mr. Aziz, if you could comment on how we can ensure access to nutritious choices of food, especially the fruits and vegetables, the variety of food choices, how we can continue to assure access, particularly for rural, northern and remote communities.
Yes, thank you for this question, Honourable Member. Definitely, the issue of access to nutritious food is an important issue. Canada's Food Guide does recognize that. There is a whole section in Canada's dietary guidelines talking about social determinants of health and social determinants of healthy eating and the importance of government working together and stakeholders working together to ensure access. Canada's Food Guide role is to provide information, the best advice on healthy eating, and work collaboratively with partners and stakeholders to achieve that. So currently, we talked about the school food program that is under the jurisdiction of the Minister of Health and the Minister of Economic and Social Development. We continue to provide information to Canadians on how best to eat according to their budget. So we have a webpage on Canada's Food Guide that provides tips and actionable advice to support Canadians in making healthy food choices while living on a budget.
Thank you. And can I just get some clarity, because we did have some recent news in the census data that youth over-indexed for non-binary genders or for diverse genders. So I'm just wondering, is there a gender lens on the youth data that we are working on, or that is being gathered, where we can understand what's happening with girls, boys, and gender diverse differently, how they've been impacted differently?
Well, I'll have to come back in writing on that one beyond the non-cisgender. That will be disaggregated to take into account those non-cisgendered identities. I will be happy to do so in writing. Thank you.
Thank you.
Because on the physical activity side, we know that girls tend to already age out sooner than boys do, and I would really be interested to know if, what was the impact on girls during the COVID-19.
Thank you.
Wellness Together or Pocket Well app. So I'm going in a little bit of a different direction, but it gets referenced a lot in terms of mental health. And I noticed, I jumped on, my app store and looked at the Pocket Well app and noticed that it has, I think, all of 49 ratings. So that doesn't seem like a very high number relatively. Can someone tell us how many Canadians, individual Canadians, are actually have downloaded that app? Is that something that's measurable? Are we monitoring that?
Thank you for the question, Mr. Chair. We are indeed monitoring that. We can follow up in writing. However, I don't have that number in front of me directly, but we can certainly follow up with that.
Ms. Zarillo for 2.5 minutes.
Thank you very much, Mr. Chair. And my question is for Madame Clifford, and it's just in relation to research around, basically gender-based analysis plus in research. I wonder if Madame Clifford would like to, or could share with this committee if there is a GBA plus analysis that happens on research that comes out of her departments.
Thank you very much for the question, and certainly the work that CIHR itself does in terms of policy and processes is subject to a GBA plus analysis. What we are doing now with those who are funded with CIHR funds is building in the conditions of funding a stipulation moving towards gender-based analysis plus. We do have sex and gender-based analysis as part of our research culture, but certainly we need to continue to do sex and gender-based analysis and move beyond that so that we're able to look at things through an intersectional lens. So sex and gender-based analysis, you will see that requirement for those funded by CIHR, and moving forward to be able to conduct research and report the results from an intersectional lens. I appreciate the question. Thank you.
Thank you, Madam Clifford. And can I also ask, is that true with studies on children as well?
It would be in terms of the research that we fund across the board. Again, one of the challenges, though, with CIHR and providing grants to researchers is that a grant, as compared to a contract, doesn't necessarily have the same controls, if you will, in terms of what is delivered. And in certain cases, the researchers themselves may say, for example, if they're doing research that is in a petri dish, for example, they may not be able to do that in the same way as someone who is doing a population-based research. So again, you will see much stronger language coming from CIHR in terms of our expectations for an intersectional approach to research.